For some people, having a surgery can be scary when you're alone, and making sense of a diagnosis can get confusing.
That's why 2 local nurses have started a medical concierge program so patients can get one-on-one care with healthcare professionals. In tonight's Eye on KELOLAND, we introduce you to the women behind Nurse Connect and the services they offer. Nicole Hansen and Jackie Farina have a combined 25 years of experience in the medical field, working in a variety of units and states.
I started out doing PCU, cardiac telemetry, specialty, and then kind of have done travel nursing. You kind of do it all.
Neuro, trauma, CV-ICU, medical, surgical ICU, all the different things. And then I started travel nursing.
They met in 2018 while working in Arizona, but later reestablished a friendship when they both ended up settling in Sioux Falls. Now they are running a unique medical business together.
Nurse Connect is a nursing concierge service, brand new and the only of its kind in Sioux Falls. So what makes nursing concierge special is that it is very privatized and individualized to people. It's in the realm of home health, but it is elevated in that we can do pretty much anything you want, and we're not limited by what is required by an insurance agency.
Take, for example, you have a major surgery coming up, but no one to drive you. Hansen and Farina can step in to take you to and from the hospital. They can even help monitor you at home to make sure everything is okay afterwards. But that's not all.
My favorite service that we're offering is called the stand-in visitor or proxy visitor service. And so basically what it is Nicole or I can go and visit someone in a long-term care facility, in hospice, even inpatient if they're long-term inpatient, while the family member takes a little time for themselves.
Plus, they'll know what questions to ask that you or a family member might not.
We understand who to call for resources. We understand how to help you coordinate some medical decisions, and also take pressure off family who, you know, we're an unbiased perspective. So if there's just conflict of we don't know what's next and what's best, we're that perfect person to come in and help advocate for what the client needs.
Hansen and Farina already have a variety of services they can offer, but they say there's room to do even more.
There's one thing that I am very interested in starting for us is basically compiling someone's medical history into a binder that can really help them see all of the history and bring it with them when they go to a new specialist, so they can look back at old labs and things like that, especially if you're new to the town and your information is not all in Avera or Sanford's charting systems.
One-on-one help that can make a trip to the doctor seem a little less daunting.
Because we do spend a lot of time with our client pre-assessing, getting their home ready, helping them understand what they need, med regimen, and then following up with them days after procedure, see how they're doing.
Just knowing that there's someone who can be on your team that really can understand what you are going through.
Hansen and Farina say they take clients within 50 miles of Sioux Falls, but are also willing to drive to appointments in the larger hospitals nearby, like Mayo Clinic. To learn more about Nurse Connect and all the services offered, follow the link under this story on KELOLAND.com.
The Lincoln football